I do pediatric orthopedic surgery, and that involves taking care of kids with broken bones as well as kids with deformities and really just all kinds of manner of aches and pains involving their arms and legs and backs. I chose it because within the field of orthopedics, I found it to be the most gratifying, the most rewarding. I've always enjoyed working with children, and I enjoy helping families. And the surgeries that you get to do, whether they're fixing fractures or repairing deformities, really make a difference in children's lives. So in addition to the fractures, like I said, the injuries and the everyday aches and pains that kids get through activities and athletics, pediatric orthopedics really specializes on deformities like club feet, hip dysplasia, scoliosis. We deal with a lot of children who have neuromuscular conditions such as cerebral palsy, that produce deformities as well as muscle contractures that need to be relieved to improve range of motion and function. I'd say just from a general standpoint, I think that my philosophy would be one of family-centered. We hear a lot about patient-centered care, but when pediatric orthopedics, you don't just have one patient. The entire family is your patient. My focus and my emphasis is really on trying to make sure that I understand that this child is a member of a family, and while the child may not be able to communicate all of the needs and the extra stuff that goes on around their injury or their condition, the parents can, and they need to be able to express themselves. They need to be able to express their concerns, ask all the right questions. And as a parent myself, I really try to understand and empathize with what's going on from the family dynamic standpoints. Many people in the community are reluctant, and this isn't just this community, it's everywhere, are reluctant to go to academic centers because of the idea that young doctors and medical students are going to be learning on them. But what they don't really understand, I guess, is that the presence of students and the presence of young, inquiring, inquisitive minds makes me better. I have to be on the cutting edge of my specialty if I'm going to teach the next generation of physicians. So these are bright young people who are motivated to learn, and their presence makes me a better doctor. So, patients have really nothing to fear. In fact, I think that the level of care they get is better. We're not distanced from our patient care. We're not distanced from the care that the residents provide. We're hand in hand, arm in arm with them. So I think all in all, it makes for a better experience because of the team approach. The ability to fix things and impact people in that way and see them get better quickly and get back to a normal, productive life is probably the number one thing that we as orthopedic surgeons get to enjoy.